Knee or shoulder pain, immediately go for a surgery. As an orthopedic surgeon, would you agree with this?
This, I wouldn't agree on this completely as well.
So as a journalist, we often encounter a lot of misinformation. One of the categories where misinformation is easily available is medical industry. As an orthopedic surgeon, how do you see this particular misinformation? Robotic-assisted surgeries are done by robots and not doctors.
See, this is completely misinformation.
When people come to you for consultations, when you recommend arthroscopic surgery, what is their instant reaction?
Yeah, a few surgeries we can have an instant recovery. Yes.
Hello and welcome to Real Talk powered by the Apollo Hospitals Chennai. Joining me today is Madhan Thiruvengada, who is the Senior Consultant and Orthopedic Surgeon, someone who specializes in robotic joint replacement surgery and sports injury. Doctor, thank you so much for talking to us. I went through your website and the first thing which says about you is, when it comes to orthopedic care, having a knowledgeable and experienced doctor is something which is very crucial. Why is this so important?
See, what I now consider is a gift. Gift means get it right first time. So that is the whole concept of it. So what I see nowadays is many people does many things. They are quite expertise in different things on that. So when you get it right at the first time itself to the patients, then there is no setbacks for the patients. So they be happy and then they get back to a normal lifestyle. So this has been my motive on every aspect of my treating of the patient. So that is how my principle is.
Choosing the right doctor, because, at what stage do you think they should consider meeting an orthopedic surgeon or consulting a doctor? Because people may have joint pains and they would have just thought that this is normal pain. If I take rest, it'll all be okay.
See, when there is a little bit of pain, if it settles down, that is fine. So when the pain is not settling down, it is having a setback on your lifestyles where your mobilization or movement is getting affected. That is where you have to get immediate orthopedic opinion so that we can analyze what is the problem with them and get the treatment early stage itself. So we can prevent a lot of other complications if it's seen earlier.
To make it very simple for our viewers, when someone says joint replacement surgery, what actually goes wrong in the body, that requires a surgery like this?
See, first and foremost is, as you asked previously, same questions on how to choose a doctor. So same thing, you have to be specific on which patients you have to be ideal for the surgery. It's not all patients who have got joint pains need surgery. So there are different stages where there is indications for surgery. One indication is pain, which is a constant pain, which is not relieved by any painkillers, or they have tried everything, physiotherapy and everything on that. And then lifestyle modification. The pain, like joint pain, which is crippling her lifestyles, they cannot do her day-to-day activities. Age doesn't matter. So you see arthritis now in early stages also, or late arthritis also. And if there is a deformity developing in the knee joint, where they cannot walk even little steps, they cannot socialize, they cannot go out and see people, then that's an indication where you need to really think whether we have to live a better lifestyle. So that is why we offer the surgeries at that time.
There is a lot of talk about robotic-assisted joint replacement surgery now. In very simple terms, how does a robot actually perform a surgery, or what happens during the surgery?
See, this is the common question asked by many of my patients also. So, sir, you do robotic surgery, so does a robot come and do the surgery? It's not actually a robot doing the surgery, it's a robotic-assisted arm. So we take help from the computerized imaging and then we feed it in the system. So in the system, there's a good analysis being done. And before the surgery itself, we know what type of implant should be put in and what type of cuts to be put in. So this is loaded to the computer, and with the help of robotic assisted, when we perform the surgery, it's more precise. Down to a millimeter, we can be more precise on giving excellent results to the patient. So that is how it's different from conventional surgery and robotic surgery.
So there is something called fast track surgeries, joint replacement surgery. How different, is it from the traditional or conventional surgeries?
See, fast track concepts which I brought in during the time of COVID on that. in conventional surgeries, what happens is previously patient used to stay for 5 to 7 days in the hospital, and after rehabilitation, sometimes a bit longer as well. So with this new concept of fast track knee replacement, where we can be discharge the patient as early as within 24 to 48 hours itself. So I have a standard protocol. So my protocol stands even before the surgery itself, getting them analyzed and getting the workout done properly, physiotherapy and everything, so that they come at the day of the surgery, get admitted, have the surgery done, and immediately they've been mobilized on the same day itself. And they are feeling comfortable, they get discharged on the next day itself. This is the whole concept of fast track knee.
And this protocol is, it may differ from case to case. On what basis do you initiate this protocol?
100%. So it's not fit for every patient on that. So it might not be right for doing this surgeries for every patient. So as I told you, there is a protocol involved in it. So one thing is we have to look at the comorbidity. Comorbidity, I mean whether they got a heart problem, any other kidney problems, also how healthy they are and how fit they had been before, any other medications they are on. So these are all been analyzed before on that. And I do a pre-op assessment also completely on that. Even the workout is done by anesthetist also. If they have this criteria being fit in, then I offer them this kind of surgery.
Like I said, a lot of people, the very common thing that people do in India is manage pain at home. People who have arthritis or people who have some kind of, discomfort, they're used to managing pain at home. So at what stage they should start seeing an orthopedic specialist?
See, one thing is pain is not good to have. Pain is something which our body says there is something wrong. Absolutely. So it has to be addressed. So you cannot live with pain. So simple painkiller, if you take and it gets better, that is a different type of pain. But even with a painkiller, it's not getting better. And if the joint gets swollen and difficulty in walking, this kind of things, and you can't be having this pain and treating them in the home.
So particularly for people who have arthritis.
Yes. That's right. So arthritis is it's not like a disease it's an age-related process. Osteoarthritis, I mean to say. There are different kinds of arthritis. Osteoarthritis is age-related process where the wear and tear happens on that. It's not like happens just all of a sudden. It goes by many years or so. That is how they become more painful on that. So there is a different stages of arthritis. So early arthritis, you don't need surgery. So it can be treated with simple painkiller, some lifestyle modification, some injections, such kind of thing. But if it's crippling the lifestyle, then yes, we need to intervene as surgically for this patient.
So what you mentioned now is very important. Surgery is not an answer for every patient who has arthritis.
That's true.
So at what stage, it can be managed without an operation? Because this is a very vital information for a person.
That's true. See, now there's a lot of fear in all the people also. Surgery, what happens if it goes wrong or so? That is a fear as well. Many people have that. So early stages, if you come to and see an orthopedician on that, so obviously we take an X-ray for the patient and then we see them how they are walking and everything on that. So if there is a simple wear and tear in the knee joint, so where it can be managed by lifestyle modification like reducing the weight. Weight has become a very common factor nowadays because you see young age people with a lot of obese, the joint taking the load and then wear and tear is more. So that can be addressed, and some exercise therapy. And there are some biological agents as well, which we can inject into the joint, so like a viscose supplements or so. So which can help them in the early arthritis, I mean to say. So but if it's late stages arthritis, then there are other options as well. If there's one part of the cartilage is damaged or so, I also do what is called as a joint preservation surgeries. So where we can replace that cartilage or just part of the joint and make them the lifestyle which they had been living before comfortably also, instead of totally replacing the joint itself.
Can you give us some examples where people who had come with a lot of discomfort and now they are able to lead a normal life?
Not some. I got many patients like that who do quite excellent on that. Interestingly, I had one patient who has come from States actually. She was here for a few months or so. She had been working here. Then she happened to meet me. She's around 60 or 65 at the time when she came in. She's a quite active person. She likes sports and she likes trekking as well.
Okay.
One request she made me is, sir, I've been suffering from this pain on that, so I don't want to have any major surgeries on the joint replacement. Is there anything you can look into the alternatives? So when we examined her and then did some investigations, there was a part of the cartilage which was worn off. So I thought instead of doing the whole knee replacements, we can replace that cartilage itself. So I took her own cartilage, grew up in the lab, then I replaced it with the cartilage. To be honest, within 4 weeks to 6 weeks, she has been walking independently, and she sent me some images as well where she had been trekking all along in somewhere in North India as well before she
Wow.
left to Europe on that. She still keeps in touch with me in the Facebook page, and she sent me the pictures of all her trekking.
So every time she goes on a trek, she sends
Yeah.
you pictures.
Yeah, that's
Yeah.
true.
So I also saw a couple of videos that you have done where there were patients who were unable to walk, and after they came to you and after you did the surgery, the procedure, the feedback is quite surprising because they all say that they are fine now. The fact that is when you try to convince these patients that they have to go for robotic surgeries or robotic replacement surgeries, what is the instant reaction that they have? Is there enough awareness among patients about these surgeries?
See, one thing, the difference in Indian population and a population which I've been dealing with quite few years ago in abroad is the lack of awareness of this surgery itself.
So that's amazing, doctor. Like when people come to you for surgeries, people who are unable to walk and people who are elderly, convincing them for a robotic surgery or like even for a surgery is a very difficult task. As a doctor, how do you manage these patients? How do you convince them?
It's a quite interesting course. It's not matter of convincing them. So it's not only the patient you're talking about, it's a whole family when it comes up on that. So because all of them have got a fear that what will happen to my mother or grandmother. So she's already elderly, like 70s or 80s. So she's got only limited age to live in, whether she'll be good enough to undergo this major surgery also. For all these people, what I'm trying to say is through this message is age is not a factor. So I've done surgery with 89, 90 years also, who came to me with crippling, they cannot walk also. Recently, there was a patient from Kerala, you can see here. So she couldn't walk also. She need two people to help her to assist in walking. She came in wheelchair. And you can see within about 2 to 3 months, she has been walking independently. Her knee has been quite straight. And she has been able to do her normal activities. So convincing the patients, not about convincing, they have to be aware of this kind of surgery. So the success rate is quite good if it's done by correct surgeon who is quite experienced, and also with the present technology of robotic surgeries where the error is very minimal. Okay. So human error is very minimal. So where we have a pre-planning, we get them all the record, X-rays, imaging, CT scans, we do it prior and do the planning and everything. With this approach, if you go, the risk is very low, minimal, I would say.
So we have talked about trekking and all that. Let's discuss something about sports injuries, which you are an expert. What are the common types of sports injuries that you see today? And ACL surgery, ACL tears, or injuries or shoulder problems, which is very common nowadays.
Good thing nowadays I see is a lot of people are going active into sports, and there has been a lot of encouragement from the government as well on the sports as well. So as you said, my one of the interest is orthoscopic sports surgery. So it depends on the sports what they play. So if you see the footballers or the field players, they have quite a bit of knee injuries. So knee injury very common is ACL injury and meniscus injury. So this is a very common injury I see in knees. So coming to different sports like a racket sports or cricketers, bowling when they do it on that. So a lot of things we see is a shoulder issues. So shoulder, what we call say impingement or a slap lesion. So slap is something like a shoulder is also a ball and socket joint. So in the ball and socket you got this cartilage and the labrum what we call. So there is some tears also. So this is depending on the sports. I get a lot of patients both on a knee and shoulder also.
So what kind of surgeries are done, particularly arthroscopic surgeries? It sounds very high tech.
So arthroscopy surgery is just a keyhole surgery where with minimally invasive on that. So within a 1 to 2 centimeters we can finish off the surgery. So that is what it is. So what we do is we make a small tiny hole. And with the camera, we have a look into the joint, and with very small, tiny instruments where we have a video imaging of what we are doing, and we do the surgery, which very minimally invasive surgery. So
it sounds very scary, right? The name of it. Maybe when you explain it, it's very simple. But when you say we have to go in for an arthroscopic surgery, it sounds very high tech, and but also my point is like, do people prefer going for these surgeries?
See, nowadays what happens is the things have gone very advanced now. So all the things are done in the minimally invasive surgeries. As I mentioned, the previous thing, robotic surgery is also minimally invasive surgery, and then orthoscopy is also minimally invasive surgery. What does it mean to the patient is early rehabilitation, pain is less, blood loss is less, and that is the main advantage of now. So a lot of surgeries have now gone into very minimally invasive surgeries.
So many people who are not athletes, but still they get repeated pain in their knees, shoulders, and backs. What are the repeat stress injuries, and why do these injuries happen?
Good thing you asked this question on that. Nowadays, life has become very sedentary, and a lot of computer or IT people, I see them with that. So mostly happens by posture. So a lot of the people have that working with a laptop, they have the neck flexed or using the mobile apps constantly on the mobile, so they get this neck pain and back pain. Another thing I commonly see is wrist pain and then elbow pain. So you do one activity in a different way and the muscles also get so stressed on that. So then you get this pain. So that is what is called as, in a nutshell, repeated stress injury. Common repeated stress injury, what we call as a golfer's elbow. So where around the elbow you get it, or tennis elbow. And along the wrist you get this decurvence tenosynovitis, where you get this pain along the thumb at the wrist level. And of course, carpal tunnel is also another repeated stress injury. You can get carpal tunnel syndrome. So those are some of the common things repeated stress injuries are.
One final question, a practical suggestion that you can give for people to avoid these kind of pain and to help us protect their joints. So what should they do, like on a daily basis, if something that they can practice that will help them to avoid these kind of complications?
You mean the whole holistic health thing?
I'm saying like particularly knees, shoulder pain, like you said. So we all sit and work on computers, or we are out on the field. We have editors whose job is to edit these videos.
That's
they
true.
sit for a long time. Maybe likewise, you have people working on computers and all of it. So what do they do to ensure that they don't have these complications in future?
Good thing you asked me on this one. So all my patients, when they come in, so I do a root cause analysis. It's not just you give a painkiller or prescribe physiotherapy and tell them that, okay, you'll be fine. So if you do that one, so they'll be fine for a week or so. But what happens is after the week or so, then again, if they stop everything, the pain comes back. So we need to see the root cause. Root cause is mainly posture. I ask them about the work, what they do as well. So if they are mostly on the desktop or so working on a laptop, so don't keep the laptop and bend forward and do it. So what you do is let the laptop be on the desk. Okay, have a Bluetooth connected keyboard or so where you rest it below that. There is always, if you see the computer table, is always there a pull out where you keep your keyboard. So that keyboard should be in your arms rest. So where you have an armchair with a lumbar support chair. So you straight erect, so your posture is erect, you have a neck support. So like you see straight like this, and then you don't bend forward and do it. So that is where you start to pain in the neck as well as in the back as well. And you can avoid this repeated stress injury, as I was mentioning on that. So when your arm is and the keyboard are on the same level, it reduces the stress to the elbow and the wrist as well. So those kind of injuries you can avoid as well when you're working on that. Coming to the point of knee, lower limbs or so on that, one thing is all of them have to have a regular exercise. So every doctor says that exercise is the one thing on that.
When we interact with
Physical exercise.
doctors, this is the first thing that they say. But yes, we are trying to do yoga in our office and all that. But here, I think we have to start doing it. Yeah.
See, all the people ask me is when you start exercise, you have to do this, where is the time? So everybody has got 24 hours. You should allot your time within that. In the workplace itself, you can find some stretching exercises. We can do that. Those are the things you should find your way to do the exercise. Another thing is diet and weight. Another thing, being a sportsman, I would always prefer my patients to have one of the sports as their hobbies.
Okay.
So sports is a good thing to have, which keeps your mind also in good health, your body also in good health.
So are you into sports? Like, what do you do?
Yes.
Big time.
Yeah, I do play badminton quite a lot.
Oh,
So
great.
even now, I used to play 1.5 hours daily in the mornings. So
Okay.
before I go to work on that, I make this a dictum that I keep active myself on that.
So I think that's a lot of inspiration. Maybe We should also start doing that. Here is another segment of this real talk where people now immediately go back to Google. If you say something, they'll just Google and they'll get, Google to answer questions about their health. So there is this section where what is the reality and what is a myth. A lot of misinformation is going on. We'll ask you some suggestions that is given by Dr. Google.
Okay.
And let the real doctor answer these questions. So here we begin. If you have a sports injury, complete rest is the best cure. As an orthopedic surgeon, what is your response to Dr. Google?
So it's not about complete rest. When any sports injury, you need to know what caused it or what is the effect of that injury on that. So depending on that, rest is one of the early stages we do. Rest and ice pack, anything we do it on that. It's not that you have to be in rest for all the time as well. So it could be a simple sprain or so, where minimal rest and then you can get back to your normal thing and stretching exercises, which can bring back to your rehabilitation quite earlier on that. So that is why you need to get assessed by a doctor.
So another people do a lot of chat GPT now. Like they have various avenues to get information about their health. Like they'll text the problem and then answers will be there. So joint replacement surgery is only for very old people. So as an orthopedic surgeon, somebody who is an expert specializes in robotic joint replacement surgery, what is your response to it?
See, that was a myth before, like old age people only we can do the surgery, also old age people only needs this kind of surgery. With this common lifestyle now, with a lot of people, I see early arthritis as well. So early arthritis doesn't mean that you need to replace the whole joint as well. So we can replace by doing a cartilage or joint preserving surgeries as well to improve the lifestyle of that patients. It's not about age is not a factor. I see it in my practice quite a people earlier also in the 40s, 50s also developing and having their joint, not taking care of their joint where they land up in having a surgery. But giving that, having said so also, they get back to our normal routine and activities. They live a quite healthy lifestyle after that as well. You don't need to live in pain. Whatever may be the age, you don't need to live in pain. Life is about movement. You are here to enjoy the life. So my advice is people, you have to enjoy the life. So don't be in pain. If you are in pain, please see a doctor.
So have you ever heard about this? Someone who has come for consultation saying once you get a joint replacement surgery done, you can't live an active life. Have you heard this from a patient? As an orthopedic surgeon, what would be your reply, your response to it?
See, I completely disagree on this one. So I mean, that's why you have to choose your doctor. So right doctor and the right hospital, right techniques if they do it also. 95 to 98% success rate is good on that. So that is where you should be careful of that one. So a lot of relatives, I've seen patients' relatives who coming there, so they had the surgery there, so they couldn't go out or anything. But I don't advise that to any of my patients. Right from the surgery day one, I advise my patients to walk on their own. So that is how my principle is. I said in my earlier talking, gift is the principle I follow. So get it right first time also. So whatever technology, whatever things is there, I utilize the best interest of my patient.
So the next misinformation that is there on the internet is knee or shoulder pain always means surgery. So that's what the doctors will say. Immediately go for a surgery. As an orthopedic surgeon, would you agree with this?
No, this I wouldn't agree on this completely as well. So any injury has to be assessed, as I said, and then we have to clinically assess and then get the clinical examination as well. Most of the things we can get away without surgery also by having a proper rehabilitation. So like in sports India, we see this runner's knee, jumper's knee or so which we can be getting away with just some simple physiotherapy exercises. And also shoulder, we got this early impingement signs and all. So some people, as I told, bowlers, they have a different techniques. They don't follow the good techniques. They can have this problem. So if it's addressed in the early stage, you can prevent surgery. Only if it gets worsen or so, if there is any pathology involved in that, that's where we intervene surgically to make them go back to a sporting activities earlier. That's where surgery is needed.
So as a journalist, we often encounter a lot of misinformation. And I was talking to a fact checker and he's saying, one of the categories where misinformation is easily available is medical industry. So as a doctor, as an orthopedic surgeon, as someone who is into robotic knee replacement surgeries and sports injuries, how do you see this particular misinformation. Robotic assisted surgeries are done by robots and not doctors.
See, this is completely misinformation. So it's not about robot performing the surgery. So being a surgeon or robotic surgeon, what we do is we get assistance from the robot. So we do have a pre-op planning, and then in the pre-op planning, which has been fed to the computer, so we know before the surgery itself what type of implant should be given on that. And it's not about robot performing surgery; it's a robotic assisted arm. So we feed this information to that, and during the surgery also, the surgeon double checks whether the information fed to the computer before and real-time information what is there is been correct or so. So with that one, with the robotic assisted arm, we perform the surgery. It's not about robotic themselves performing the surgery.
Thanks for the clarification, because many people would think something like this. As an orthopedic surgeon, when people come to you, when you suggest arthroscopic surgeries, as an orthopedic surgeon, when people come to you for consultations, when you recommend arthroscopic surgeries, what is their instant reaction? They say that when you do arthroscopic surgery, then it means instant relief and instant recovery?
Yeah, few surgeries we can have an instant recovery or so. So like what happens in the joint itself, if you see the knee joint itself, if there is a simple tear or so which can be sutured or which can be trimmed off, so they can have immediately they walk on it. So I do a lot of procedure, arthroscopy procedure as a daycare procedure. They come in the morning, they can be discharged by evening or so. Certain procedures hardly 1 day stay. That's it on the arthroscopy surgery. That's the main advantage of arthroscopic surgery on that. Of course, earlier there was a fear of any surgeries. Nowadays, the people feel the arthroscopic keyhole surgery. Now there is a general awareness that will be the best for the patients also.
So the last myth is, as an orthopedic surgeon, somebody comes and tells you, if the pain comes back, then the surgery has failed. You must have done hundreds of surgeries, thousands of surgeries.
Yeah.
So when somebody comes and tells you this, how do you respond to it?
See, first being a doctor, you need to know where the pain is coming from. So patient might be having a perspective that, okay, fine, I got this pain and then I didn't have this pain before, now I'm getting this pain on that. There could be something entity calls referred pain. Say, for example, in the knee joint itself also, because of the long-standing walking, they have a different type of walking pattern. So this puts unnecessary stress to the back also, back and knee problem. So once the knee problem is over, then there is a back problem which is not being resolved. Now they are walking straight or so. Now that gets into their mind. So back problem. And that back problem, what happens, there is a disc prolapse. That could be a referred pain which goes down the leg. So which they were ignored for a long time, because knee was a bigger issue. So I see many patients like that. So that is why when I see the patient, I analyze the patient completely, look into other joints and other areas as well for the pain on that. So in this way, if you do a proper analysis, then you can address this issue. Some of course pain might be because of surgical error or so on that. But most of the time in my practice, what I find is it's not the real pain. It's a different kind of pain on that. So that is how you need to understand.
So thank you, doctor, for sharing all your valuable insights. It was a pleasure talking to you.
Thanks for having me here as well. Thank you.